Hi, good morning. I want to talk about hip flexors and the role in movement today. So what is hip flexion? Hip flexion is when the angle between the femur, the thigh bone, and the trunk decreases. So think hip flexion as we bringing the knee closer to the chest. So walking, running, climbing, lunges, squats are examples of hip flexion. Sitting is also hip flexion, or when we are bringing our trunk closer to our femur, so when we are bending forward. The hip flexors also have a role in keeping us upright, especially the psoas. So the hip flexors are a pretty important muscle group. There are 11 muscles involved in hip flexion, and these muscles are also involved in other movements, so they're not primary hip flexors. For example, back to the psoas. Psoas is a hip flexor and external rotator. Same as the iliacus, flexes the hip, external rotates the hip also. Another example, sartorius, which is a two-joint muscle, originates in the hip, crosses over and attaches by the medial side of the knee. So it flexes the hip, external rotates the hip, and also helps in abduction of the hip. But also because of the attachment below the knee, it flexes the knee and internally rotates it. Other example for a hip flexor is rectus femoris, also a two-joint muscle. It originates in the hip, attaches by the knee. So it's a hip flexor, but also involved in knee extension. Another example, glute medius, which is an interesting muscle because the anterior fibers of the glute medius involved in hip flexion and internal rotation. The posterior fibers of glute medius are involved in hip extension and external rotation. And the medial fibers are helping to stabilize the pelvis and also abduct the leg. Because 11 muscles are involved in hip flexion, this is why it's important to mix up our stretches and strengthening exercises if we want to build a fully integrated and functional, balanced body. This is also when Pilates, yoga, and mobility work come into play, versus doing the same 2 or 3 hip flexor stretches and strengthening exercises in the gym. Another important fact about hip flexors, tight hip flexors, that they are the one that limiting us our back bending exercises. So in Pilates, think of swan or the rocking. In yoga, the wheel pose or the camel pose. If the hip flexors are tight, the pelvis can't roll back on the femur. That's why we feel a lot of compression and low back pain when we're trying to do back bending exercises. So, but also actually in when we're trying to do hamstring curl, if it's in a regular gym workout, or lying down hamstring curl, when the hip flexors are tight, we're not able to utilize the hamstrings at its full length. A hamstring curl would be single leg kick or double leg kick in Pilates, lying down hamstring curl, examples for it. My mentor, Kara Reeser, that I still work with, she gave me a very important cue when it came to back bending. So she said to think my head as my first vertebrae and my bum as my last vertebrae. So every time I'm trying to do a back extension, thoracic extension, neck extension exercises, or wheel pose or swan, it was 100% game changer to think of the head and butt as first and last vertebrae to prevent the compression in the low back. So not hip flexion, but hip extension. If, and I already said the answer, if back bending is limited by hip flexion, what is limiting our forward bending exercises? It's a test question. It's the hamstrings, right? So the hamstrings are as I said, they're hip extensor and also involved in knee flexion. But if the hamstrings are tight, it prevents the pelvis to roll forward on the femur, and we're using our back to compensate for lack of flexibility here. So just to recap things, and I should probably sit down because my head is cut out here. I don't know how to adjust the camera. So to recap things, 11 muscles involved in hip flexion. And these muscles are not pure hip flexors, they are involved in other movements as well. This is why it's important to add more variety to our stretching and strengthening routine. This is why it's important to incorporate yoga and Pilates into our workouts. Number 2, the biggest limiter in back bending exercises are tight hip flexors, because when the hip flexors are tight, it doesn't allow the pelvis to roll backward over the femur. That's why we feel a lot of compression and maybe pain when we're trying to do back bending exercises. But if you think of your head as your first vertebrae and your bum as your last vertebrae, I think that's it was a very good cue for me to help preventing dumping everything into the low back. Not hip flexion, but hip extension. Biggest limiter in forward bending is the tight hamstring. Doesn't allow the pelvis to roll forward over the femur. That's all I can think of as far as hip flexors. I hope you find these little segments useful. I really enjoy learning and talking about anatomy and movement, and I hope you find these little segments here and there useful, and I hope you learn something new. Thank you.